This guide is to find your life and narrow your focus. True living, cultivate your purpose. Available on Amazon now today. Pick up your copy.
Hey, hey, good morning, good morning. Good morning, y'all. How y'all feeling today? Hope everything's going well for you and welcome back to Eco Nation News, news that you may or may not be able to use. If you can, give me a thumbs up. Let me know you can hear me and see me. If I'm coming through clear and you can hear me and see me, give me a thumbs up if you don't mind. We have another day today here in the beautiful state of Florida, Northwest Florida specifically. It is overcast. We done had a little rain. Got early this morning. We got a little partly clouds, and then we got a little peak of sun. Then now, right now, it's all overcast. The humidity is it's there. You can tell it's there, but it's nowhere near as strong as it has been. Oh, okay. Thank you. Thank you for the thumbs up. Thank you. Thank you. Thank you. I'm glad. Darth X, what's going on? Belinda, how you doing? And y'all put some T's in the chat. If you're thankful for today, put some T's in the chat. Belinda coming in strong. She's saying she's thankful. She's thankful. She's thankful. Today we're going to have a interesting conversation. In the description, I put a link that kind of stimulated this discussion. I've been having this discussion for quite some time. I've been playing with a lot of different things in my brain, and that can be dangerous. You know, imagination is something. Me growing up as the only child, my imagination tends to run a little bit wild, and it can get a little bit crazy. But I want to have a conversation just with you. You are here, and I would like to engage with you. So please feel free to use the comments. There's no right or no wrong answers. We're going to have a online live discussion about the idea. Imagine a world. Wait a minute. Wait a minute. Let me get everything ready. Imagine a world where you can go to the doctor and there will be no cost whatsoever. Imagine a world where no matter whatever your pre-existing conditions or whatever, all of your conditions will be taken care of. Imagine a world with free healthcare. Can you imagine living in this country with no deductibles, no co-pays? You don't have to go to this provider versus another provider. Everything is pretty much available and it's here. And if you need anything, no matter how large or how small, you can be taken care of. I couldn't imagine a world like that. It would be simply amazing. I know darn well that this ain't my friend right here. Is that Ben May all the way from Florida? Is that my friend Ben May from Florida? Only thing worse than not thinking at all is too much thinking. That's my friend. He ain't gotta say that there. What's up, Ben? Good to see you. Man, it's good to see you. You brought a smile on my face today. Good to see you. But imagine for one reason to have a time in life where healthcare is free to every single citizen that's here. I'm not talking about if you're not a citizen, nothing negative about that, but they may have to do copay. They may have to have insurance card, of course, emergencies. Now, I'm not talking about emergencies or nothing like that, but just imagine the fact that you are a U.S. citizen, the fact that you are here in America, that you could have free healthcare. And I'm not talking about this universal health care. I'm not talking about any of that because the link it stimulates the brain. It does not mean that I'm aligned or I'm in agreement with any politician or anything like that. But I want us to use our creativity and our imagination on what that would look like. And then I got some suggestions on maybe how we could actually get there. And I want y'all to say, man, you either crazy or you align or bring something, add something to the table because we're looking for some solutions, because people like my young friend Ben, they are the future. And if we can invoke change and if we can create change and create ingenuity and free thinking, and then also apply some of these principles, sometimes it can work. What's going on? That is my beautiful sister, Auntie Bev Jones, how you doing? Hey, free healthcare. Invest in your workers. They help the world go around. Now, that is totally true, but I want to take it a step further. Even if you don't work, you got free healthcare. Now, when I said that, some people may be like, here we go. People who not working, they're not doing this, but they will pay in. Now, if you're a citizen, we all pay in. Now, I'll share with you my ideas, but let's before we get this pot cooking, let's go ahead and stir it up a little bit, put in some ingredients, and give me your thoughts about right now, is healthcare expensive for you? Do you have access to healthcare? And if y'all can, just put it in the chat. What's your thoughts? So just give me your general ideas and thoughts about right now the current situation that we have with healthcare, because some people are totally fine. Some people are like, hey, that's not even an issue. I don't mind the copays. I don't mind that. That's typically someone who rarely goes to the doctor. Most people, if they have to go to the doctor, whether it's frequent or infrequent, the moment that they had found out the rules, and they always changing, the payment, the co-pays, the supplemental costs, and all these different things, sometimes you notice that you get those surprises. And one thing that we definitely know right now, healthcare is not transparent. Like lately, I hate to say it, but lately I have been interacting with this healthcare thing. And before they can really see me and take my blood pressure and take my pulse, especially when you go to the ER, there's a person that either roll around a cart or they'll come in with a pad. And the first thing they want to do is what? They want to collect your name, your social security number, your address, and your insurance. Sometimes even before they begin administering. And if I didn't play a part years ago in the background, whether we like it or not, long-term, short-term care, your quality of care a lot of times can be based on the type of insurance you had. Some people don't realize that, but certain people with great insurance will get certain things versus people who may have less challenging. I learned that with long-term and short-term care behind the scenes because I used to bill patients, I used to service the patients, and I watched some of the numbers and some of the financials, and I thought it was quite interesting. So let me go to the chat because I see the chat moving. I'm going to try to do better with keeping up with the chat in a timely manner. Ben says, okay, I read that one. Yes, sir. I've been good, my brother. I've been good, man. Ben, I need you to check out one of my previous videos. That flower you got right there. I got some growing out here on the land, my friend. I got some growing out on the land. You're gonna have to pay me a visit one day, real soon. Let's see. I grew up in that world as a military child. It's not like that now. That's a great point. Now, even today, I grew up as a military child too, and I remember every year we would have to go on base because my mom and my father, they were divorced, but my dad, he was enlisted, and I used to go. We used to drive and go and get my identification card, and I know that was a big help. And without a doubt, law enforcement, military, frontline, medical. I don't understand. When I was in the medical field, I was working in the medical field. We had some of the worst insurance. I hate to say that. The way we do our medical community right now, it saddens me. It's people who actually do. I'm not talking about an HMO or nothing like that because it could be great within your section of your HMO. But once you go outside of your area, it's a challenge to get taken care of. You might be in an area where you got resources everywhere, and that's what that HMO is. And I won't go through this insurance thing, but I want to tell you the bulk of the problem is insurance. It is that capital type mindset we incorporate. It shouldn't be between food, healthcare, and protecting our vulnerable people, our kids, our disabled, our vets, and also our elderly. There shouldn't be issues with making sure they're taken care of. If you're capable, able-bodied to work or what have you, yeah, we should be able to do what we need to do. But the moment that anybody falls in that thing, it shouldn't even be no question. Those people should be put on the front line, should be first, without a doubt. But I know things have changed and life is not always like that. Belinda says, "Hey, Belinda, how you doing? Much love to you. With my son needing a kidney transplant, if there were no dollars involved, it would be so helpful to just focus on him and his care." And that's something that I'm glad you brought up, because a lot of times we are so distracted, not just with healthcare, but with life, because of dollars. Dollars really, it stresses us out. Not only that, but it takes away our attention on what is really important a lot of times, because the dollar amount is such a driving force. And that in some of my previous lives, I just kept talking about, we put money or not being broke. Some people say, well, you don't have to have money to be broke and broke. Let me tell you, in this country, lack of money means you're broke. Okay. We can go all through those semantics about what is broke and what's the definitions, the mindset of this and that. If I need product A and I can't get product A because I lack the financial ability, then I'm determined as lacking or not having. That's the broke I'm talking about. I'm not talking about no mental, none of that. I'm talking about reality, what everybody face and what everybody is challenged with. Because here we have a mother that can't focus on their child's need like they would like to because of a dollar bill. That should not be so. That should not be so. Okay, I'm dropping the phone. My bad. Trying to keep it where it's steady. Hey, Gigi, how you doing? What's going on? You see Ben, don't you? Hey, what's going on? Good to see you, Gigi. All right, Gigi's not gonna stay up, are you? I'm trying my best not to rattle this thing too much. I see you thankful, Gigi. Good to see you. Thank you. Please hit that like button. And Detangled by Design. Hey, what's going on? What's going on? Salute to you. I don't think it's expensive for me. And that can be determined based on the person, what type of insurance you may have, what your deductible, what your copay. People who feel like it's not that expensive typically are people who are not only financially fit, or they may have great benefits. They may have a great plan, which definitely brings down the cost. And something that Auntie Bev was bringing out about all of those deductibles and the added costs and stuff like that. But this is the thing. If you have a great job, then you should have great insurance and all of this. I think if you're working part-time, 3 and 4 jobs, what's the difference in that person? I believe that person still should have access and the right and low cost. Because think about this. If I'm working a corporation or I'm working a business, I'm working an entity, and my insurance cost is low and I'm getting paid good, don't y'all see the conflict in that? What about the people who go in, they have to walk to work? They walk to work, they can't work no more than 39.4 hours. They have to work 2 of those jobs, sometimes 3 of those jobs. They trying their best to survive. There's a video out with a mother in Orlando, Florida. She works at around a lot of theme parks in Orlando, Florida. She can't afford an apartment. She has to live in a extended stay or a motel, and she got about 2 or 3 kids, right? But she walked to work, she catch the bus, and she is gone majority amount of the day. And she works, I think, 3 jobs. But altogether, that pay is not enough for her to have a place where she can afford to stay that's nearby. She would have to literally be somewhere on the outskirts of that area, which the job doesn't support it. People like that, what should their insurance costs be? Should their insurance costs they should they have to debate whether they can pay for food, utilities, insurance costs? But what if we didn't have a cost? How would we pay for insurance? What do y'all think? You think that's something that could be obtained? Do you think that's something that could be reality? Do you think that we could live in the United States as citizens of the United States? Do you think that we could actually have free healthcare? You think that that is something reality? And it doesn't matter about politics. Let's not confuse politics, but we're talking about human, um, not just not I wouldn't say rights, but just having that access. We are one of the greatest countries in the world, from what I hear, right? I haven't lived in other countries, so I can't speak to any other country. But do you think we can afford it here? Do you think that we could truly afford free healthcare? And then what would that look like? And I'm also curious about, what if we no longer left it in the hands of private sector businesses and insurance? Because right now you can go to the doctor, to, let's say you go to the hospital, and then they end up giving you maybe an IV, and they give you some ibuprofen, and they give you a health management printout, and then they send you along their way. If you go and you look at the cost of that IV, if you give a cost breakdown, you look at the cost of that ibuprofen, it would have been cheaper for you to just go down the store to the dollar store, general store, to get the ibuprofen than it is for it to be administered at the hospital. Why is the cost 20 times higher for the same thing? Most of the time, people will tell you it's the administrative cost. It's not the cost of the actual medicine or medication. You know, you get a roll of towel, you get a towel, you get soap. Everything is calculated in that cost, but it goes through so many hands just to build your insurance companies. It goes through so many hands just to do coding and billing that it just spikes up the cost. What if that was eliminated now, where the hospital got to make some money, right? Okay, the hospital got to make some money. Just say they did a markup, a flat markup on everything, medication, on services, and just say you need a kidney transplant. This is the cost, and this is the markup. And nationwide, that's what the markup is. Now, costs will probably fluctuate, depends on where you are here in the United States, of course, because you got cost of living, you got cost to do business, you got access to different things, you got delivery costs, you got a bunch of other stuff. But what if we brought the barrier, reduce the hidden fees and all that, and we start being transparent and truly showing that ibuprofen, a bottle of ibuprofen may cost you $4, $5, $6, but you get one or two given to you in the hospital, it may cost you $50. I'm just pulling out a number, but when the last time you ever looked at the cost of basic things that you can get from right down the street? And why is the cost so much? Why is whatever new medication, we got innovation, we got automation, we got state of the art labs, we got all of this stuff. And then once you get down to the manufacturing, we got cost that's down to the pennies per medication. But then when you sell it for this premium price. Why is that? Why is that? And then you watch some medications where they get sent over to other places, repackaged, rebranded, and they're much less because they base their costs on that market. They base that cost on what people are able or willing to pay. But why do we not get to decide that? Why here we don't get to decide those things? So I'm just curious on what you think. Wales 803 Gardner, how you doing? Good to see you today. Let's see. O says, I joined the military when I left my retired military parents' house. When I got out, I was completely flabbergasted about the cost of healthcare. Yes, Yes. And it's so many different things that I believe that if we had more accessibility to it, they would focus more on preventive care. And that's something that we really don't discuss enough about. We really don't even look into it. We don't look at other alternatives enough because it's such a big business. It's such a big business. And I believe that if we could pull private sector out of people well-being and healthcare. Now, I'm not saying completely get rid of that market. There's a market, there's a niche for that. But then the people who are able to pay it competitively, they can pay for that. But to have that intertwined with people who really can't afford it, and then you still not giving it to them, right? Because they don't have the insurance. So what about we pull that completely out? And what if we might have, or we manage it as a country and take the private sector completely out of that piece? And if we do infuse the private sector, because I do have a concern about innovation. Private sector competitiveness brings about innovation. Innovation can come through, okay, what's your cost? What's your markup? Your cost, your markup should be the same across the board. If I'm in New York getting the same piece, the same treatment, the material, I'm not talking about the service, I'm not talking about the bill for stay, I'm not talking about the physician pay, I'm not talking about the nurse pay, but I'm saying a product, and this is why I want you to be just open-minded. The product, the medicine itself, why should the price of the medicine be like night and day in Alabama versus New York? It's a product, right? I get it, fuel costs, freight costs, or whatever. If it's near the plant, not that much freight, right? Should the cost be up? But the problem is we don't get to see it because we have insurance and we do almost like credit card. We swipe or we check in and we allow the insurance industry to negotiate and do all of that stuff, and we have no say so whatsoever. We don't know the cost, and we just watch every single year the cost of our insurance, the cost of our deductibles, the price, the co-pays go up. We watch the cost of insurance go up every year, and we say, where does it stop? Where does it end? If we're paying more than our forefathers paid, more than anybody has paid in such a period of time, why don't we ever have decreases sometimes as we get healthier, as we do better as a country? Why not? If they saying we live longer, they pushing back retirement, they pushing back a lot of different things. If that's the case, that means we're healthier, we're doing better. If we're truly healthier, why don't the costs reduce some years, some decades, some quarters? Why does this always have to be an increase? There's never a decrease. I don't understand that. If things fluctuate and costs fluctuate, what about us getting some of the benefits and some of the times when it do go down? I'm just asking. I'm just asking question. BMA says, in my experience, it's usually be affordable, but gets expensive for pre-existing conditions or long-term prescriptions. Free healthcare would also be good for mental health care as well. Healthcare is healthcare. It should be from your head to your toe. It should be dealing with anything that deals with your body and your body not working properly. And that's what I mean by healthcare. So mental health definitely would be included in that. And we need to put more emphasis in that. But once again, it's all about right now the money. The money, the money, the money, the money. Belinda says, my son has independent insurance, not with his job, cost him $310 a month for a young man is a lot. I mean, $310 a month is a lot for an old man like myself. I mean, $310, it is a lot. And if you're not working a full-time job, that could be very costly, especially with the rise in rents, the rise in food costs, the rise in transportation costs, and just living, period. O says healthcare is a lucrative business. Yes, it is. But what if we flatten the tires on that lucrative business? I've been blessed to experience a lot of different things in my life. And one of my jobs that I worked at, we did medical, pharmaceutical, supplies, and I don't want to say too much because I don't want to because a lot of my information is out there, but we did do pharmaceuticals, right? And there are times where I know we could have continued production and manufacturing some of those goods, but the additives were low, or we were without some of the additives. The additives had side effects, and we would stop production just because we couldn't add the additives to that piece of product. It was fully permissible for us to do it without those additives. But like I said, you have, and this is the thing, whenever you manufacturing and whenever you're producing things, you have so much variance with everything because due to supplies and due to you mass producing. You can add, you can subtract. That's even from animal feces to, it's so much, they do have variances, even with your additives and different things like that, where if you don't have certain ones, the product is still a good product. And if you're in manufacturing, y'all understand, I know one friend of mine, they did peanut butter, and he was telling me about how many parts, how many millions of parts that they would see where it was a peanut factory, peanut butter. They would have rats, mice, and their droppings and insects, but they had a variance where it was so many, they can only have so much per part. So I don't want to go in and gross nobody out, but there's variance. Anything that's mass produced, that's mass produced, you're going to have no difference between in your kitchen. You're going to have some things that may happen and may not happen, but you can't control certain things when you're mass producing it. But that's what those labs, and that's what the independent labs that are in those facilities, they test, they do product sampling and all of that. And they have a range. What's going on, a resilient dad? Attention. Okay. So the discussion today is, do you all think that we can have free healthcare? And do you think do you think that really can be realistic or not? Detangle says, this is a debate I have my head frequently. I often wonder what must be sacrificed in order for there to be truly free healthcare in the USA. What do you think we would need to give up as Americans? And that's a great question. I'm glad you asked that. And since you asked that, I got some ideas. So you all know that we would probably have to, if we just put this across the board, just say across the board. My thoughts is, let's look at true cause. First of all, we got to get transparency on what is the true cause. We also would have to get an understanding with these private sector companies. We have to form some type of alliance where we can provide so many orders. It would probably have to be federally or state ran. The government would have to manage it. Some people shuttle, but it can be supported because we spend a lot of money as citizens, and also people that come into the country through tourism, through people that travel. If there was a flat medical tax, and that flat medical tax only supported our citizens and didn't support everybody else would have to go through whatever we have to go through. They would have to provide the insurance. They would have to provide this and that. But if you're a citizen, if there was, like, instead of insurance, you paying insurance, your medical insurance, you would just pay. There would be a fee or what they call a tax, where they would take it out of your check, and it could not be commingled with other accounts with government. It not like our Social Security. It could not be commingled with any other account. It goes into this one pot, and this transparency would be just like the stock. You would see what's the cost. What is the cost that we are spending as Americans, and we're in a digital age. You should be able to look up your county, your city, and see how much your state has in the coffers for healthcare. You should be able to see what's the cost for a procedure, whether it was a root canal, whether it was a broken arm, broken foot. You should be able to see all of that cost. And then maybe if we had a balance of every household has XYZ amount of costs, but then if you didn't spend that, it goes rolled over to the next year and to the next year. So if you did have a major event happen, you should have some surplus. Now, if you did have a major event, we could co-share. We could co-share some of that, almost like vacation time with a job. You know, somebody gets sick, or sick time. Somebody gets sick at their job. Sometimes some of us will have a lot of sick leave, and we could share our sick leave. We could share it amongst each other. Maybe we could have a family or a community of a collection of individuals. You get to pick some of your collection of individuals who you want to share some of your expenses or what have you. And if you want to add anything additional in there, it's in there. And what I mean by transparency, I'm talking about every medical. Like, I should be able to see what they pay for ibuprofen, or I'm just using that high blood pressure. Just say lisinopril. I should be able to see what I could go to, key in the zip code, and see what lisinopril is at that location. And I get it. There can be markup. That way we can still promote the private sector business, but it should be a flat rate markup. No more than 15%. No more than 15% markup on whatever medication. That's the max. And then it should be, that's where the competitiveness come in. So these private sector companies, they'll show the cost. Here's the cost to produce this, show the breakdown, and they should be monitored. It should be true cost. And just like we see other companies, they should have to bid for our business. We should be able to put in whatever we need to put in, especially like routine medicine. I'm not talking about emergency. Emergency, you don't have time to bid, you don't have time to shop. You should have access for emergency, just like emergency. You go in, you get it done. But for our day-to-day, everyday medical needs, things we use on a routine basis, we should be able to just shop. We should be able to see that. Not you go up to CVS and then they shop it. And we should have that control where we can negotiate and we can shop for our own and have it competitively procured. Now, you can make it very easy. It doesn't have to be hard. If people can buy on Amazon and people can buy on eBay and all these places, we should make it so easy and so transparent where you can truly see right now the going rate for a bottle of XYZ is XYZ. Now, you still could go somewhere and pick it up and you pay for it from, if you want to use CVS or any type of other chain or place, you still got to go, and they don't just give it away like candy. It still needs to be regulated for us, allowing you to only have, you still got to have prescription, all of that stuff. Nothing changed, but we've taken now, instead of the insurance and all the billing and the multi-level billing, and then they got to get paid. Just understand, when you submit your insurance card, someone has to go and run that insurance card. They have to go and take a look at, here are your action items. These are your copays. Someone is doing all of that stuff in the background. They got to get paid. Then billing, they got to submit the billing. They got to submit the invoice. Somebody that gave that actual care has to submit something. They got to get paid. what I'm saying, it's a lot of hands, a lot of systems that we paying for, a lot of transactions we paying for. Then it got to get approved. And once it's approved, it's released. And then there's processing fees and there's all this kind of stuff, which boosts the price up completely. Completely. I think if we really look at it and we really got more transparent with a lot of this stuff, I think the cost would dramatically reduce. And then I think with having that responsibility to be maintained and kept by federal or state, there will be more action items and more initiative on preventive care, preventive maintenance, and also it'll probably even be a lot of incentives to maintain and keep good health. So I don't know. That's just some of my thoughts. Y'all let me know what y'all thinking. Let me go back to O says, I know someone who had to file for bankruptcy because of medical bills. Ugh. Oh man. Yeah. Gigi said everyone should definitely have access to great medical. Yes, I totally agree. Everyone. Um, well, thank you, and thank you for your comments too as well. Ben says, I think the biggest hurdle wouldn't even be policy or politics. It'll be the insurance company. They make so much off of. Yes, I'm telling you, that would be your biggest challenge. I totally agree. A lot of people, they think about pharmaceutical companies and this and that, but the insurance industry would definitely, and they are very powerful. They control a lot. I mean, a lot of people don't understand it. A lot of your banking, your financial institutions is all intertwined with insurance companies, and some of them are owned by insurance companies. It would totally disrupt the insurance company. Um, it would rattle the cage, basically. It would probably destroy a lot of the insurance business. But what would it do for us? What would it do for the people? You know what I'm saying? What did we do before we had this in place? You know, you had your local doctors, you had your local nurses. You know, there's things that are in place and there's workarounds. But I think that I totally agree. That would definitely be one of the biggest things. O says, the first time I got out the army, I worked full time, went to college full time, and was in the reserve. My job didn't provide benefits, got sick, missed pay, and had to pay the doctor and meds. And let me share this with you as well, just to kind of add to this. I remember at one time when I was an entrepreneur, first of all, healthcare was through the roof because I was an entrepreneur, small business owner, and the copay was through the roof. And not only that, when you got to pay out of pocket for something you used to paying $10 to $20 for as a copay, or $50, $200 and $300 for a visit, $160, $170 for a visit, and they in there for maybe 5 minutes and they out. I think if we were all in that situation without insurance, a lot of these costs and a lot of these fees would not be as high because they would go out of business. If we were all on the same playing field and no one had insurance, a lot of these fees, a lot of these stuff would not even be nowhere near as high. It's corporate greed for sure. What's up? Bless up, family man. Hey, how you doing? All smoking tea. Good to see you. Good to see you. Welcome in. I don't think I've seen you before. Welcome to the chat. Never a decrease. You're right. It's a lot of stuff. How often do you hear about decrease this year? This year, your healthcare, this year, your insurance costs went down. And because you didn't spend that much, and because your company didn't spend that much, we're giving you all a decrease in premiums. When do you hear that? You know what? You got a young working, some business, and this is the thing. Did you not know that if you are working at a company, they have a group insurance? Did you not know that in order for them to figure your rates on group insurance, they take a look at all the employees, the demographics of the employees. They take a look at how is it a high risk job? They look at the age of the employees. If you got a bunch of older people you working with, your insurance cost is probably going to be higher. If you got a bunch of younger people you working with, your insurance cost should be lower if they're being transparent and actual. But if they're not, the sad part about it, you got some companies, especially like the tech companies, the insurance should be so low for those tech companies. It's not high risk. It's not a lot of high risk, not a lot of physical labor. You got a lot of young people. So guess what they're doing? The insurance companies are cleaning up on that group insurance rate. They're cleaning up because most people really don't utilize the doctor as a whole. I'm saying healthy people as a whole until you get older. So if you got a company with a bunch of older people, typically your insurance rates or premium should be higher. But if we don't see it, we don't know it, you should be able to look at company A and look at what are their group rates versus company B. And then if that transparency were there, people start asking questions. But the problem is no one knows what company A pays for their premiums. No one knows that. Matter of fact, have you ever thought about this? The company that you work for, you get insurance taken out of your check. How much are they collecting with all the employees? And then are they getting surplus? Because you have fluctuation in people coming, people going, people terminating, people getting fired. So think about this. Whatever that deductible is, that company pays a portion of it and the employees pays a portion of it. But do you really get to see how much is really owed? And I know those numbers has to be extra because of the fluctuation in staffing, but are some of these companies making money off of these premiums? I don't know. I'm just asking a question, just out of curiosity. Y'all let me know your thoughts. Just let me know your thoughts. Don't you think that should be transparent that if this company premiums are XYZ, the company you work for, this is what their premiums are, whether it's annual, monthly, quarterly, you should be able to see that. And then you should also see how much the employees are putting in there. And are we comparing apples to apples? Why isn't that transparent? That should be transparent. We need more transparency to the healthcare field. We need more transparency to what we're actually paying. We need to know how much we truly are paying. We also need to be able to compare and shop. And I'm not talking about emergency situations. Once again, if you're just new coming in, appreciate you coming in. We talk about free healthcare. We talk about healthcare. But we got to have a conversation about where we are in order to get to free healthcare. We first got to lay out, we don't even know what we're paying for. We don't even know what's the cost of anything. We just pay it. We pay our copay, and then we pray and we hope that there's not additional costs. And then we open up the mail or we open up our email, and then we say, hey, the insurance paid this, the doctor was paid this, your copay paid this, but there's an extra cost here. We should have everything laid out, drawn out. And then we should also be able to see, okay, what's the going rate for a local physician? What's the going rate? You know, is this facility much higher than this facility down the street? If so, do they specialize in something? Because you have certain facilities that specialize in a certain field. Yes, they should get paid more because their area of focus is on that. But is it dramatically higher or is it reasonably higher? Matter of fact, if we go to the next metropolitan city, is this specialized physician more expensive than this? We don't really have any transparency. We don't know what we're paying for. We just know we pay, we put it into a system, and we hope for the best, and then we keep it moving. And my question is, what's your thoughts on that? What are your thoughts? O says, I have tried to grow my own produce for the past 4 years because I want to know what's on my food. Sadly, I have not been successful yet. find you a grow mentor, find you a growing club near you. Once again, a lot of them for free. Um, just be intentional with it. Don't give up. Don't quit. There's a lot of information out here online too as well. But another thing, find you someone that's locally near you. Find, get to know some of your neighbors that may be growing, as you ride around your neighborhood, or even around the area. You see some people growing or what have you, try to strike up a conversation. Go to your local farmers market, strike up a conversation. If someone producing some of the things that you would like to eat or grow, have a conversation with them, ask them what are they doing. You know what I'm saying? We got to be intentional about what we're doing, and just be creative and find ways to not give up and to keep going. Hey, Miss Shirley OG, what's going on? Good to see you this afternoon. O says, I recognize that the commercially grown foods are full of chemicals that make us sick. You know, we pay for convenience. And just like somebody asked, what does that look like to be able to have free healthcare? Nothing's free. And that's why I didn't want this to be clickbait. But the reality is nothing is for free. Someone has to pay at one period and one point and one time. Me personally, I don't have no beef with paying with nothing. I don't have no issue with paying with anything. But if we buying a car, we get to compare prices. We buying a cell phone, we get to take a look at true costs and prices. We buy a TV, we buy all this other stuff. But when it comes to our medical, when it comes to our health, we don't get to truly see what's the comparative analysis. We don't get to see pricing. Now I get it. Inside of insurance, they'll tell you here you can compare different providers. No, I don't want insurance in there at all. I don't want insurance hand in that at all because they'd already negotiated. I'm not really at the table, negotiating table. I would like to be at the negotiating table for us as a whole, as a group, us as a whole. I would like for us to be able to compare on prices and overall costs. Darth what's going on? Okay, you talking. He says, I'm working on growing my own food, mixed results this year, and slugs ate my starts. Yeah, let me tell you, nothing great, nothing's this great doesn't have sacrifices. Animals, insects, they and the weather can be your worst enemy when it comes to garden. That's why I always say double up, double up. A lot of times what I would do too is I'll do starts and I do seeds. You know what I'm saying? I seen times when my starts did well and my seeds did horrible and vice versa. But you got to be diverse. You got to be relentless too. Just like the insects and just like the slugs themselves. Slugs for some reason don't like salt. You know, I had a slug issue at my last location, and I know I used to love sprinkling salt out there in my beds too as well. Epsom salt is a great because it not only nourish your plants and it also is good too as well. Belinda says, I believe that Canada has free health care, but they cannot have pow for protection and have higher taxes. That's why I say they're paying it through their taxes. It's not free. They're paying it through their taxes. But this is the difference. Everybody gets it. If you buy something out the store and if we did 2 cents on every dollar for your health care, whatever you buy at the store, 2 cents, would you be willing to pay for it if it costs 2 cents? Put it in the chat. Let me know. If you made a purchase and even people that visit, people that go on, if everybody paid 2 cents per dollar, would you be willing to sacrifice that for free healthcare for every American citizen? Y'all let me know. Put it in the chat. Put it in the chat. Hey, my Renaissance, what's going on? On the side note, I hope AA are not using lisinopril. I got you. I got you. Let's see. Here we go. Belinda, Dorothy says, I'm in Canada. Where are the explosions? Yeah. She's talking about that personal protection. Yeah. Okay, we talking. I'm not going down that path right there because yeah, none of it is designed for the body. None of it is. I mean, some are worse and some are better, but do your own research. Thank you, Detangle by Design. Thank you. Thank you. Bless up. Thank you. Thanks for this. I appreciate you coming on in. Thank you. Much love. Thank you for supporting this channel. Thank you so much. Really appreciate it. Let's see. O says, check your bill. My husband had knee surgery and was charged for stuff that was used. He's an orthopedic tech and has had to scrub in for surgeries. So he knows what tools need to be used. You see what I'm talking about? That's sad, y'all. Who's checking the checker? Who's checking the checker? How can we check if we're not? Do y'all understand what I'm trying to convey? I'm just hoping y'all understand. What's more important in your health and your body? Help me to understand. You mean tell me money, cars, cell phone, dresses, slacks, designer jackets, designer coats, cufflinks, socks? What's more important than you and your health, your body and your health? What's more important than that? But yet, here we got somebody in the field that's checking. And just because they got a knowledge, they see that they billing them for stuff they didn't even use during the procedure. So this is my problem when I talk about transparency. You realize I'm at the age of 50. Do you realize how many years it was before they start putting labels? And notice they're getting worse too. It used to be good when they first came out, but you get any type of medication, you used to have a package with it. You had on the label, it says what it's treated for, right? It gave you side effects. Now some of them still have that, but if you notice, sometimes they don't tell you what it's treated for. Sometimes they tell you to refer to the package. And sometimes that stuff get lost. It's not connected with the actual bottle. Or what if you got a caregiver that's providing you your medication and what have you, and then they not sure what that medicine is and what it's for. But then you tell them, hand me that pill, them pills over there and then there's two and they pick up one and you know what I'm saying? It should be where, okay, my stomach hurt. On that pill, it should say for stomach problems, for this, for that. We need transparency. We need more transparency. If you got for instance, a concentrator that's on your invoice and on your bill, and you weren't connected to no oxygen or nothing, you got nasal cannulas on your bill, and you were never connected to no oxygen or anything like that. You see what I'm saying? If you don't know what those items are, you don't know whether you being billed right or not. But then the sad part about it, you just say, oh, it's copay. My copay got it. I'm not going to even sweat it. I ain't pay but $20. And see, that's the problem. We look at that copay. We say, oh, I ain't pay but $20, but we feeding the beast. If somebody's paying for that, right? Who's paying for it? Everybody collectively paying for it. Because if you really take a look at the insurance companies, just say I'm a medical insurance company. You think that one company, just imagine this. Okay, let's just close our eyes and use our imagination. So I work for company A, right? Company A has a deductible, copay, what have you. They spend XYZ amount per month in medical expenses. That insurance company got 1,500 company A's, and it all goes in one pot and they distribute it. Now, if they were truly transparent, truly looking at it, which they do, they'll say this company A over here, their medical costs is rising. We need to go up on their premiums. But guess what? What happens if this company A over here goes down? They don't go down. And if 10 of these companies end up costing more, everybody go up. In that whole section, everybody go up. Now, they won't tell you that, but it happens. It happens. Because we have no transparency. We don't know what's going on. We don't see what's in the pot. And all we concerned about is that copay, that $20, that $15, that $50 copay. As long as that's not affected, I'm good. But what we watching behind the scenes is the costs go up, 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 up. And how they get you is you looking at that copay instead of looking at your whole total $310 or $500 or $800 per month that still steadily rise. I mean, per year. Per month out of your actual insurance cost per month is steadily rising, right? We're not paying attention to that because, well, I only had to pay $25. So if it goes up this year, I realize the cost to do business goes up every year, but your pay don't go up. Your hours don't go up. Your bonuses don't go up. How can everything keep going up except for things that benefit you? And then we don't ask for transparency. We're not asking, I want to know what you're making. I want to know what you make off of this. I just gave you $100 for this prescription. How much did that prescription really cost? Did it cost $5, $6? But you charged me for $100? I mean, is that lawful? I get it, but if you're not transparent, I can't see everything. I don't know what's going on. That shouldn't be. Especially when we talking about our bodies, our health. We talking about our health, our bodies. That should be top priority over, I know what they paid for that car. I know I could break down the cost. I could look at the cost of an alternator. Or I can look at the cost of a set of 4 tires. I can look at how much profit that company made and over this and how many tires they sold. I can look at their P&L. I can see all of that stuff. But I don't know. I don't know. Our priorities, man. Our priorities are real kind of different. O says he was also billed for aspirin that he could not take because he's on blood thinners. Sent him a bill for $20,000. This thing real out here, folks, man. There's some people suffering. There's some people going through a lot. And it's not no one individual person. It's all of us collectively because we all are participating in this thing, right? And something tells me if we were able to manage and to see what really goes on, some people say, well, we'll put our health at risk. What kind of mindset that is? What kind of mindset? You're not qualified enough to take care of yourself. You're not educated enough to take care. You're so slow and so dumb that you will put yourself at risk. But then we sit here and we watch people who can't afford it on a daily basis and they don't have it. They don't have access to it. And we don't worry about them. But we think that we're not intelligent enough to be like, okay, I'm going to shop for this. I understand this. I'm going to take a look at it and see what I can get. I'm just saying, come on, man. Praise the Father. Billy made a mistake on his insurance. Thank you. Belinda says, I work in healthcare billing, and it is so hard trying to explain the billing and insurance process. People do not understand why the insurance does not pay for everything after they pay so much. Because this is the thing, Belinda, I'm glad you said that. That's why I'm saying they are at the negotiating table for you, for your benefit on your half. Insurance says we're not going to lose money. We're not going to be at a loss. Screw you that's paying it. Screw the medical providers, screw everybody. We are not going to be at a loss. You got to understand, we will not cover you if we're going to lose money. We won't do it. We won't even break even. We won't get close to breaking even. Matter of fact, in order for us to show that we're strong, we're resilient, to show that we have abundance amount in our coffers, we will make sure that we will be profitable at any expense, including you. And we got to understand that they say, hey, for certain procedures, we're not paying no more than such and such. Medicaid, Medicare do the same thing. All of that stuff is all supplied. You might get access through certain avenues, but it's all through those insurance companies. And they say, hey, for certain procedures, for certain things, we're capping at this, and this is all we're doing. And then so the doctors, the physicians, the organizations, the associations, they say, hey, we need to make our money. Your insurance only pays such and such. You did pay your copay, but when we bill, we only got paid so much. So we need these thousands, we need these hundreds of dollars for you to make up that expense. Before they saw you, they knew how much they could get for whatever they were going to get, right? And guess what? They know what type of insurance. When people say, what type of insurance? You'll hear doctors or you'll hear people in the medical industry that deals with billing, or especially doctors. If you ever got a conversation with some doctors, they'll be like, if you're new to an area, you ain't from that area, and if they want to take you on as a patient, they'll say, what kind of insurance you got? What kind of insurance do you have? Or if you call the doctor's office, or what type of insurance do you have? Because what they're doing, they're determining whether they're going to be profitable or not. Well, we don't take that insurance. Why they don't take that insurance? Because they don't like the cutoff rates. They don't like the cutoff, the limitation on what they're going to get billed, what they're going to actually get paid. They don't like it. So we won't take this insurance. We won't take that insurance because they're telling us how much we're going to get paid for certain procedures, for certain things. And it's not in our best interest. So we're not going to take that insurance. And that's what happens, right? That's what happens. Versus back in the day, Dr. Bricker on Little House on the Prairie, Dr. Bricker would be like, oh, I know you didn't do good with your crops. I know things didn't go too well. I'll take such and such for that. You know, because he was in the community, he knew the community, he knew the people, and it was no swiping. It was no, what insurance do you have? It was just plain old people that needed help. And when they needed help, he got to still get paid. He still got to make a living. And people understood and respected that. But then his name and his reputation was more valuable than him making a profit. Because everybody knew that the talk of the town, and he would no longer be the go-to doctor if he was screwing people. I mean, people will cut you off if they know they screwing you. But now we don't have a choice. We're into this system, and this system just says, this is what you're going to do in order to pay to play. You're going to have to do this. Otherwise, you're going to be lacking, and nothing you can do about it. So decide whether you're going to get on or get off. Karen, what's going on? Our son has the exact same situation, but in reverse marriage and child medical bills, active duty with the medical bills. In most cases, he had to pay 70% before insurance. And Karen, that saddens me because 70% is a lot, y'all. And a lot of our entrepreneurs, I'm trying to tell you, people don't understand what small business owners go through. They have no freaking clue. And my thing is, if you're playing so good, Mr. Insurance companies and all this stuff, why wouldn't you collectively say, small businesses that are this way and that, we're gonna put you all in a pot, and we're gonna bring down your group insurance, and we're gonna allow you to have a lower deductible. But what they do it on their benefit in the back, but they don't share that abundance of benefit with you. And that's That saddens me. That saddens me. And when are we going to break that cycle? When are we going to break that cycle? It would require the hospitals, it would require the doctors, it would require a lot of different people. And I've talked to some doctors who said, I don't even take no insurance. I don't want the paperwork. I don't want to deal with it. I do cash only, cash or card, cash or card. That's all I do. I don't even want to deal with no insurance. I have, it's not a lot of them, but you do have some of them because they are sick of them being controlled by these insurance companies. They are sick. And when we talk about corporate greed, that's the bulk of the issue. That's the bulk of the issue. We are growing grapes for an alternative to blood pressure meds. All Spoken T says, what happened to the buy land in the South video? I didn't get a chance to see it. Buy land in the South video. Oh, I'm not sure. I'm trying to remember buy land in the South. Okay, I got to go back and look. I'm trying to remember which video that is, buy land in the South. Ben says, I think another good point of discussion is the unnecessary health care costs. If you visit a doctor for a consult and all they do is recommend you to another doctor, what are you paying for this? Facts. Facts. Why am I paying a whole doctor bill for him to tell me go to see somebody else? Man, see what I'm saying? We got too much sense. We are not utilizing our noodles, fam. When are we gonna start questioning what are we doing? I go and I sit in here and I wait. I should have got money back because I took off on my job. I took my sick time, and then I had to wait for a long period of time before they finally got in there. And then when they got in there, they end up telling me I need to go see another doctor. Or let me call over here and get a referral, give you a referral. Why should you get the whole pay for that visit? See what I'm saying? If we could manage our stuff and we could see prices, now you mean to tell me if they do that 20% of the time or 10% of the time? I mean, a lot of doctors these days, they do referrals, especially if you got good insurance. Man, if you got good insurance, they're gonna send you to a specialist. The specialist gonna actually do the work. The doctor the doctor is the one that got to send you to the specialist. You can't just walk to the specialist, be like, man, I know my general practitioner cannot deal with my stomach issues. I need to walk into this specialist. No, you can't walk into this place, sir. You got to be referred to by a doctor. Well, I know my general practitioner don't have no way to check it out my intestines and my stomach. They don't do that in that office. Why can't I come in here and make an appointment? Why I gotta go pay him, go sit, take time off of my job, use my hours that my children could be using when they get sick, and I do this, and then here I am, I'm going over here, driving, spending my gas, putting on some clean clothes, taking another bath. I just got off of work. I gotta get off of work, then I gotta go home, drive home, change my clothes, freshen up, and then get back in my car, drive to the doctor's office, get to the doctor's office, sit and wait and wait and wait, and then go and see the doctor. And then the doctor says, yeah, I'm definitely gonna have to refer you to the place I just left. Yeah, okay, you gonna write me a referral to the place I just left. Yeah, on your way out, just go ahead and make sure you pay your copay. Oh, these days, they don't even let you even go back these days. Some doctors, they used to let you do copay on the way out. But now these days, they go ahead and take the copay out. Time you come into the doctor's office. And if you don't show up, sometimes they'll still take the copay. Right? Ben, excellent. I mean, it's just practical things like that. Can you audit your bill? If they gave you a whole itinerary, do they make it easy for you to audit your own bill before it's paid? Do they even give you that? You should be able to go in there and be like, even if you don't audit at the time of service, just say you're not in the right health, or you're not this way, or you're not that way. It should be a period of time where you should be able to get a refund or something especially the cash, the dollar payers, because some people, they don't have insurance. They paying out of pocket, paying out of pocket. Now imagine what I just said with the referral, and imagine you didn't have insurance. Imagine you didn't have sick time. Imagine if you barely had gas in your car. Imagine if here you are, you live 50 miles away from that doctor's office, and then the referral place is right there where you work at. And now you going 50 miles over here to go to the doctor. Come on, man. Some of this stuff just ought to be practical. I should be able to call in and say, look, I'm having some serious stomach issues. We done talked about it. You know, we done talked about it. I definitely need a scope. Can you send me a referral over to such and such? Why do I need to go in your office? Why do I need to deal with that for you to turn around and do a referral? Hey, Queen, how you doing? Bless up, bless up. Good to see you today. Absolutely, yes, yes. Urban Guard Chronicles, hey, how you doing? Let's see, I think people can pay 0.2 cent a little at a time for taxes over the higher cost of healthcare. You know, I don't know if you ever did math, but if you think about how much money do America make? Like when you think about this, I'm just saying, how many dollars are spent every month through tourism, through transactions, through whatever. So as a consumer, you go to a store, you buy something, right? How much money would it be able to collect? Something tells me that just with those 1 or 2 cents, something tells me if we had a mathematician in here, it'd be interesting to see how much money that would be every year. Hey, what's up, Vision? I appreciate that, man. Thank you, thank you, thank you. Don't forget to hit that. Don't forget to smash that like button, folks. Don't forget to share this out. Amazing live. I appreciate that. Thank you, thank you. Karen and Thomas BSR says our son is a surgical tech, also, but in the U.S. Army. That's what's up. That's what's up. Lorenzo, what's going on? Hey, hey to you. Long time no see. Good to see you, Lorenzo. Dorothy is talking to Belinda. Trying to stay out of personal conversation. Let's see. Belinda says it's sad the doctor has to take adjustment for being in network, and the insurance puts the rest to the patient deductible and pays nothing. I mean, let me share another thing. There's so many layers to this thing. We could be talking all day long about this. Your job chooses what insurance plan, not the insurance company. The insurance company, they could have their way, they give you the best of the best. See, it's so many layers to this thing. Your job says, in order to keep costs down to my employees, most of my employees have a decent kind of health or whatever, then I'm choosing this plan. Therefore, I don't have to pay a lot as a company, and my employees don't have to pay a lot, and it makes us, well, we okay. If that makes sense. I don't know if that makes sense. I'm hoping I'm making sense to you all. So they'll choose a certain plan or package for the group or for the employees or for the business, the organization. Now that package may not be the best of the best, but that's there to keep the price down. This is why I keep saying, what if they weren't even in the transaction? What if the insurance company wasn't even in the transaction whatsoever? Things would be so much different on this playing field. Costs, I know, would go down. They'll be more competitive. They'll be more obtainable. And transparency with everything would allow us to be able to have intellectual conversations, would allow us to negotiate, would allow us to shop for pricings, would provide more competitive environment that would definitely bring down costs, and it would definitely help us as individuals. But the problem is, like Ben said, the idea of removing insurance company completely out of this transaction, they got they got they got power. They got a lot of power. They paying for a lot of people in a lot of high places. They got a lot of political pull. They got a lot of financial pull. So the idea is a great concept, but imagine almost everything that people are talking about cost and the high cost. If we notice, and the more we get more in depth, we start reducing the reasoning for high cost from these pharmaceutical companies, and we're really looking at who is in between the pharmaceutical companies, the healthcare providers, and the patients. Insurance companies. And don't get it twisted. If you're on Medicare and Medicaid, that's still a form of insurance, fam. It still are rates. It still are negotiated. There still are negotiated pricing for services and all of that. Imagine if that middleman was no longer there. You can go directly to the provider. You can go directly to them. I think things would drastically change. Let's see. Haji Homestead. What's going on, Haji Homestead? Good to see you. Darth let's see. I'm not trying to be controversial. I'm trying to crunch the numbers. Go ahead and crunch the numbers. Go and crunch the numbers. Let's see. Let's see what happens. Let's see. Queen says insurance is a money-making business. It's about profit and the refuse to take a loss to a form of usury and not right. They all work together to make sure they are making the profit, all caps. End of the day, if we're business owners, that's the whole intent. And I get it. Lord knows I get it. My question is still transparency. Transparency. Did you not know that if I sell something online, whether it's Amazon, whatever, Facebook, Marketplace, Craigslist, or whatever, when I sell something, right, you know what they do? They go and they look at comparative items typically before you buy it. Some people, they'll say that's a reasonable price. But how do we know what's a reasonable price when it comes to our healthcare? How do we know that that's a good price? Most of us as a whole, unless you're in that business or in that sector, most of us don't even know what's a great deal or what's a good deal. We don't know whether we're being fairly treated or not. We don't even know whether our company that buys the insurance, because the plan is not with you. You might be paying in the plan, but the plan is not with you. It's in with the company. That's not your plan. That's why when you leave, they have supplemental, because that's not your plan. That's the company plan. So a lot of people say, yeah, I got insurance. Do you really have insurance? No, you paying your company insurance policy, not necessarily yours. And sometimes we don't think about that. And my question is, how do we know our company ain't getting ripped off? How do your company knows they're not getting ripped off? Where they shopped around, they did this. But what happens if insurance company made a consortium, or I'm not saying they did it, but just say they said, hey, let's lock this thing down. Let's get these rates. Let's get the going group rate for so many employees, such and such. There's a standard. There's an industry standard. I get industry standards, but what happens to the transparency for us to be able to see? And why does the industry standard keep going up when they say we're getting more and more healthier? We're living longer. We got more centennials. We got more baby boomers that are living longer and all of that good stuff. Why don't we see any decreases? I'm just curious. Why don't we see any? O says, let you be 15 minutes late to your doctor's appointment. They will cancel your appointment and charge you on a no-show fee, but they can make you wait for an hour. Who's important? Who's really important? Who's really important? My Renaissance says they're sending you a message through my card asking you to pay your bill before you even get to the office. But if they refer you to somebody, they should reverse that pay. You should get your pay back. If you have to wait for a certain, how about that? If I have to wait for a certain amount of time, I should get a reduction of my bill. If I have to wait for extended amounts of time, I got an appointment at 11 o'clock and I get in there at 12 o'clock or 12:15 or 12:30. I should get a reduction in my bill. I should get it. What's wrong with it? Because we're talking about service, right? And they say my time is money, right? That's what they tell you. You know, my expertise through my education and my time is money. Your time should be worth something too. Your time should be worth some money too as well. Weldon says, I was automatically subscribed to Elon Musk's YouTube channel. It said a different channel name, but directed me to Musk. It is an AI loop of Musk asking for a crypto donation, saying, okay, that's kind of off the subject, my friend. I don't know where you are with that, but we're gonna talk to you a little bit later, Weldon. Thank you for coming through. Appreciate it. Let's see. Is this a new one? They have passed a no surprise bill, and they have to give you an estimate on the bill before the service. Hey, what's up, Miss Native? What's going on? Good to see you. Queen says, we must do our own due diligence because they will take advantage. Ignorance, that ignorance, boy. Look into the no surprise bill. Gotcha. I'm gonna check that out, Belinda. Y'all check it out too. Look up the no surprise bill. Appreciate that, Belinda. Thank you. And she's in that actual field, so I'm quite sure she stays on top of everything. I definitely gotta check that out. Tetra Mom. Hence, this is why the majority can't leave their jobs and step out on their own. Because if you got a good job, you got good benefits. You got good benefits. That's the way we can keep you. Whether I don't know. I want to jump into that, but I'm not gonna jump into that. I'm not even gonna touch it. Ooh, you trying to bring it out of me. Miss Native, my hubby is a baby boomer. He has more energy than I do. See, we should be getting a deduction, right? As a whole, there should be some cost savings, right? What happens if you do have good health and this and that? They say, well, you get but if you're in a group, I don't know. All this stuff is kind of weird to me. Hi, Shot. What's going on, Shot? Many blessings to you. Thank you. And family man. Yeah, y'all see my friend Weldon. Y'all go ahead and know what to do. Y'all moderators know what to do. Hook them up. Take them where you want to go. Ben, in other fields, there is a hospitality consideration. If you go to a restaurant and they get your order wrong, you can send it back and get a new one without charge. Why not healthcare? Ben, I need to have Ben on here. Y'all want to see? We need to do a live. What? They'll shut this thing down. So basically, Ben is saying you go, but come on, Ben. In their defense, they say they practice in medicine, so that means they may not get it right. So they saying from the time you walk in, So let me say this, Ben. I see where you're going. I like it. I would love to play with that because we could go all day with our words and with our conversation. But one good thing that protects a lot of people in the medical field is that they are practicing. And they say that from the very beginning in that industry. It's almost like if I am a property, what it is, you go and you get your estimate for your property, what they call property appraiser. If I'm a property appraiser, the first thing that the definition of a property appraiser is that it's an art. It's an art. So an art means it's through my creativity. Everybody's gonna have a different opinion about it, right? So it's an art. Same thing about practicing medicine, Let's see, Touch says, I don't even go to the doctor, but yet have to stay tied to the system in a high stress job. I feel you. I feel you. A lot of others do too as well, and it's sad, but it's true. But if you ever need to go to the doctor, if you got a good job with good benefits, that one visit could be worth all them co-pays you did. Just one visit is something serious. Hopefully, don't nothing seriously happen. But if it did, because I'm not bashing insurance. Don't get me wrong. I am an insurance agent too as well. But insurance is needed in society, but it should not be the hub to the wheel for so many things that we need. It should be something as an added protection versus it's such a necessary item in so many cases. And it's infusing itself into our everyday lives. And the quality of care and any of that should not be driven based on which type of insurance. I'm not saying it is, but I'm not saying it's not. Family Man said, I learned about portable insurance from a friend of mine. Yeah, it's so many different alternatives, and there's so many different ways. But I'm still asking about free healthcare. You think it's reality? You think we could really do it? You think that here in the great United States, that should be something that we should have? Queen said that's considered malpractice. That constitutes lawsuit. I'm not sure which one. Let's see. As Nate said, power just went out here. No storm, just rain. Well, I hope y'all be safe, and hopefully you be listening at the channel. You prepared. So, all right, here we go. So our last comment. Here we go. Says, oh yeah, that time I was talking about how I was sick with no insurance. That doctor made a misdiagnosis and therefore prescribed unnecessary medication that I had to sacrifice something else to pay for. Gotcha. She also said, that made me get back in the Army. I got you. Well, y'all have survived another Eco Nation news that you may or may not be able to use. Y'all check out in the description the link that furthers this discussion about free healthcare. I don't know if we can truly obtain free healthcare. I think it's a great idea. I think it's a great concept, but nothing's for free. And we understand you have to pay for things, but I definitely know that there should be more transparency. There should be more competitiveness from us where we can be empowered because it's dealing with our bodies. And I like that idea of portability, taking your insurance from one place to the next and this and that as you go, and whether you're employed or not. I mean, this stuff, it doesn't matter. What if you're an entrepreneur? You should be able to take it, go here, go there. But the problem is calculated risk. And if you leave a office job and then you go into a sawmill or you become a electrical guy or a linesman, that insurance may be different because of the risk. And I get that. But if I'm a linesman and I know for every occupation, there's an occupation number. If I am a linesman. I should be able, if we're going to deal with this insurance thing, I should be able to key in my zip code, my occupation, probably my age, my health, and I should be able to boom, see what everybody else is paying, going the average in my area. And then if I was considering moving to California, whatever, I should be able to do that. Transparency, y'all. But y'all be well, be blessed. And I'm fixing to get out of here. Until the next time, don't forget to keep on growing. Grow. Y'all stay blessed now. Take care. Peace.